We see very, very graphic, very gory injuries from fireworks. If they explode in your hand, disfiguring injuries. People with fingers blown off, it can knock you backwards, causing broken bones, causing head injuries. The burns are the most significant things. I mean, burns are terrible injuries to have to deal with. The fact that we're a burn center here, we see them as well, and it's not my favorite thing to deal with. People don't really die of the burns themselves, they die of the aftermath, so the sepsis and things like that, because of how hard it is to take care of them while they're healing. And so, you can have disfiguring injuries, things that cause really bad scars, but then you also have the infections and things like that, and it's just a long road to recovery. They're not something that we like to see, and it happens in very young kids too, because of the fireworks, the people around them, using them, and they just go in and grab things that, aren't supposed to be, they're not supposed to be playing with. So I would say it should be done in a very controlled setting. I don't like them at all. I tend to have a tendency I like the big shows, even though those are dangerous. But if you're going to use them, keeping them away from children, and making sure that they're away from buildings, away from structures, away from places that they could, if they tipped over, they're not going to go into a crowd, because they're explosives, and they're not meant to be set off into somebody. I've actually seen people play with fireworks in that way, shooting Roman candles at each other. Kids in my neighborhood used to do that growing up. Looking back on it, it's really, they're really dangerous. And so you don't want to spend months and months in the hospital after, something that is preventable. If you're going to use them, don't use cigarette lighters, use the long lighters, use some type of wick to light them, and make sure that they're far enough away that they're not going to cause any problems.